Well, I'd like to welcome everybody to the medical marijuana awareness webinars. This particular webinar is going to be on pain and chronic management and also medical marijuana. As you know, we put these webinars on every Wednesdays and we address different subjects. Today's subject matter is one that I think is important to a lot of people. I know it's important to me. I have pain management, one of the things I use medical marijuana for. A couple of things I want to point out before we begin. You'll take a look at your screen. You look at down below, down here, you see a little button that looks like two little balloons. It says Q&A. That's for questions and answers. So if you have any questions, which we would love to answer for you, please feel free to just type your questions in there. We'll try to answer them either during the presentation or we'll answer them after the presentation, but we will try to get to every one of your questions and feel free to ask them. There is a chat button as well, but we kind of reserve the question Q&A for the questions. We kind of keep the chat more on the side. We're not really going to be doing a lot of chats on this particular webinar. The other is that I want to point out that we do these webinars, like I say, every Wednesday. If you go to Marijuana Aware, you'll find that there are a number of different webinars coming up. Next week's will be on True Leaf. The week after that on chronic pain, and one after that will be, actually, we're introducing a harvest. So you'll harvest the dispensary. So you'll be able to see a number of different topics, followed by stress and anxiety. Today's webinar, I'm going to be doing it, co-hosting it with a gentleman named Dr. Bruce Rubinowicz. Dr. Rubinowicz is with Maxim Medical. He's known for pain management. He's a doctor here in Florida, and also he also has his own private, not only private practice, but he has a store down in the Fort Lauderdale area. Rubinowicz is a little bit late today. He had a flight. He's trying to come back from a flight, and his flight from Fort Lauderdale is delayed. So he'll probably be joining us in just a few minutes. I'd like to mention that this is serious business for us. Pain management is something that most of us, who especially on this webinar, are looking at trying to get answers to. And so I'm going to try to provide some information that hopefully will have you understand what it is, how we treat it, and how cannabis can help with it. To get things started, I'd like to share a slide deck with you. Now, I don't want to make this a seminar or a webinar based on slideware. I want to make this something that's based on your questions and really trying to answer a lot of your questions. But I do think we need to set a baseline to be able to get a lot of that done. And that's what I'm trying to do with this particular process right now. Now, let me mention to you, as I mentioned before, our objective with these webinars is very simple. We want to promote the safe use of medical cannabis and use education as a way to promote discussion. A lot of people have heard about it. They've heard about cannabis can do this and that. We're really here to discuss what it can and what it can't do. And also, because it's a sensitive subject, we're trying to bring in both practitioners, advocates, patients, doctors, researchers, trying to bring information together. Everything we've done has been vetted by medical doctors, by researchers around the world, including from Israel. So we feel very comfortable being able to help you with your particular situation and at least defining it. What's interesting about pain management, it is the most common issue that brings patients to a doctor. Not only just a medical marijuana doctor, but also a medical doctor. In talking to Dr. Rubinowicz and preparing this webinar, he was mentioning this is one of the main reasons that doctors get not only the visits, but it's also been something that drives a lot of especially the medical marijuana business, it drives a lot of patients to taking a look at this as an alternative. So what are the most common complaints about pain? Well, one of the issues that comes up is people talk about what they call chronic pain. And chronic pain is interesting in that it actually drives a number of factors. I'm going to define what pain is for a minute, but chronic pain is something that people have. It's usually caused by more than one condition, and it's something that comes on gradually and stays with you typically for more than 6 months, and most people have had chronic pain for more than 18 months. It's interesting that when we talk about the subject of chronic pain, that 5 years ago, doctors actually said it didn't exist. And the reason it didn't exist is because they were looking for a particular issue that caused the pain, when in fact chronic pain is usually 2 or more conditions that are creating the pain. So that's why it made it harder to diagnose. Acute pain, which is another type of pain, is something that comes from some sort of an injury or from a medical condition. And so if you take a look at what from a doctor's point of view, you know, when they define what is pain, it's both the emotional as well as sensory feeling that has actual potential damage to tissues, tissue damage, and also is described as something that can hurt your body. You can actually feel it, as you know, but it's also not only just the physical part, but it also causes the brain to kick into place where you have a lot of emotions around it. This is where a lot of people have fear, they have future expectations. I know that in certain cases, and I bring that up because if you have pain, for example, and you have trouble walking upstairs, or you have problem opening doors and things like that, it not only hurts you from a physical standpoint, but pain also has some issues that also from a mental standpoint can really help, contribute to making your life a little more miserable. That's where it gets into this whole flight or flight type of a syndrome. The consequences are a number of different things that increase your heart rate, your blood pressure, your sweating. So pain has a lot of side effects that contribute to doing things to your body that really make it difficult for you to be able to manage. As I mentioned, chronic pain is something that persists for usually more than 3 months. It occurs regularly, and that's very different than something that's acute pain, where you may hurt your finger, you may hurt your leg, knee, you may stub your toe. That's something that comes and then it goes. You still have pain, you still want to address that issue, but it's something that that is a bit different in that you usually can identify what it is. You can put a cast on it or something like that, and you can address it. But chronic pain actually is one of the top, what they call long-term disability issues here in the United States, and it's something that's been a lot tougher to diagnose. Now, medical cannabis is very good at helping chronic pain, but let's go for a second and take a look at something interesting. If you're a doctor and you're trying to figure out how do I diagnose this, there's a number of different ways that you can try to diagnose pain. There's these MRIs, CAT scans, CTs, there's EMGs, there's ESIs, there's physical exams. There's numbers of ways that people try to figure out why you're in pain. It's important to understand that when they do an MRI, it's something that helps them to identify the abnormalities, but it doesn't necessarily assess that you have pain. It's just trying to identify something that could cause the pain that's there. The EMGs, the NCSs, again, they're not necessarily testing for pain. They're just looking for potential something that from a nerve standpoint, they're looking for something that has the small sensory fibers. They're trying to figure out why it's occurring. So a lot of the diagnosis here is trying to figure out why it's happening, and they're going after a lot of that. Also, when you do ESIs and nerve blocks, what they're trying to do is they're trying to provide relief to a particular pain-caused situation. Now, I point a lot of this out because all these things that the doctors have been doing to test this, and I'm not trying to downplay doctors, but in many cases, when you have inflammation, that inflammation causes pain. And if you can reduce the inflammation, you can reduce the pain. What they're trying to do here is figuring out where it's coming from. And in many cases, your body, who knows that you have the inflammation, really wants you to be able to address that particular issue that'll help reduce the pain, not to mention exactly where the pain is coming from and what it's exactly doing. This is an MRI, for example. Dr. Rubinowicz, this is his neck, where he actually has, you can see from an MRI, it shows that he has a problem that's in here. Now, it's interesting that when a doctor actually looked at this, and he was telling me when we were preparing for this, that the doctors looked at this and they were looking at different alternatives, which could have been a number of different interventions. That would be, for example, surgery was one of the things they brought up. And when you do neck surgery, that's a serious situation. But it doesn't necessarily reveal how to get rid of the pain. They're talking about how to intervene with it, but there could be other alternatives to, for example, surgery that you can take a look at. Now, again, I'm still recommending that you still work with a doctor, and I'm still recommending you listen to your doctors. But I do think that there's interesting situations where, again, the doctors are trying to be very clinical about it. They're trying to figure out exactly what the one problem is. But in the case of chronic pain, again, there's 2 or more situations that are conditions in play that are causing this to be able to happen. Now, what's interesting is that the National Institute of Health, a task force, who went out and looked at the MRIs and a number of different ways of looking at pain, they basically came out and said that things like MRIs and NCSs are not reliable in classifying chronic pain. Good for identifying acute pain, but not good for identifying chronic pain. And again, as we get older, I'm a senior citizen. Chronic pain is something that we live with, and that's something that the doctors have difficulty trying to treat, because what they're trying to do is treat, again, a number of different conditions that are out there. Also, the doctors have difficulty trying to figure out how to do what they call measure pain. Different people have different pain tolerances, and some people tolerate a lot of pain. Some people don't tolerate pain very well. But that's something that you need to take into account when you're trying to address how to solve your pain management problem, because you have a legitimate concern about how much pain you have, and you know how much pain is there for you to be able to conduct your daily life. And there's no way that the doctors can measure the pain level that's there. I know that when I'm in pain, I have a problem working. I have a problem concentrating. Candidly, I'm a little more on edge with people. I'm not my normal self. And this is what we're talking about here. How do you get your life back? How do you get back to the person that you used to be when you have a situation where the pain is nagging and it's keeping you from sleeping and things like that? What's interesting is over the last couple of years, and this is studies that have been done, and Dr. Rubinowicz brought this up. If you take a look at this is disabled workers. What's interesting is the amount of what they call, this is like the muscular type pain conditions. They've been going up since 1996 over here. I think that happens for a couple of different reasons. One of them is because they're able to diagnose it a lot better. And number two is we have a lot more situations where people are being put in a position where they're actually finding out that that they get hurt at work, and a lot of that has to do with a injury that causes pain that's over here. You notice the number of circulatory conditions and respiratory conditions are going down. This is where they're making environments cleaner, and this is where they're making it so that it's easier. They're providing equipment for that particular work that's done. But still, the problem is these things are on the rise, and there's a number of reasons that they're looking for the causes and that type of thing. But more importantly, let's take a look at what are the options that people have to be able to manage the chronic pain that you have, or the pain management that's out there. Most of it is a result of muscles, ligaments, tendons that are causing problems. Many of the patients do not need surgeries or invasive procedures. You have certain doctors, I know that in my particular case, I had a situation where I'd hurt myself, and the doctor's first answer was surgery. Well, it turns out I didn't need surgery. I'm not saying he made a good or a bad decision. I just kind of have had this condition before. I just kind of needed to be able to do some physical therapy and some other things to help out. And that's where they actually find that PT, strength training, massage, and yoga can also help to be able to not only manage the pain, but also get rid of the pain. I know that in my particular case, when I go out and I get my walking routines done, when I do Tai Chi, when I do that, my pain levels go down. And it's really interesting how that helps me quite a bit. When I don't do it, my body tells me, and then I do have some sort of problems, and I do have some sort of issues. This is where the wellness part of taking care of yourself before the injury, or to avoid an injury, or after the injury comes into play. Now, I'm not saying that you go out and do a lot of this kind of stuff when you actually have an injury. Again, work with your doctor. But as you're coming back, things like yoga can be very effective. I know Tai Chi is very effective to be able to help you be able to get over a lot of the injuries, to get that flexibility back, to get that range of motion back, to be able to get, again, from a neurological standpoint, help you recover and get a lot better. There's something called NP3. And what that does is that helps evaluate from the standpoint of your tissues. It helps you identify the physiological responses that people have to pain stimulus. And again, a lot of the pain causes depression, fear, anxieties. And this is a way of being able to take a look at what it is. It's something that's there, and it's something that you have to deal with in the pain management area. If you understand how your brain and your nervous system responds to this, it's very important. That's very important to being able to solve it. And I know that there's a number of different ways that doctors take a look and try to measure it. They have different devices that they can connect to your body, and it tests the amount of pain that's there. It tests the responses that your system is having. It tests your pulse rate, your heart rates. It's taking a look at your skin, but they're able to identify how much pain you're in using this type of test. And this is something that's important because that tells them exactly how much you have to, in coming up with solutions, it tells you what type of solutions that can help you and where to go. And these tests, you typically go into an office, they connect some instruments to you, they measure it, they measure that you're there, and they're able to find out exactly where the pain's coming from and how much pain they see from a body standpoint that your body is putting up with. Now, how much you can tolerate and how much is your body being disrupted is really the issue. What they're testing is the disruption in your body. That's what they're looking for, is how much your body is being disrupted. That's different from your pain tolerance, but it is something that's there that actually helps you be able to, it's something that's be able to take a look at from the standpoint of being able to say, I have some tolerance to it, but that doesn't mean that I don't have a condition that's high or low that's going on within your body. Now, during the test, there's different stimulations that are done. And what they're doing is they're looking, again, like I mentioned, they're going throughout your body to really find out where this problem is coming from and why it's there. I know that I have not had one of these, but in Dr. Rubinowicz and a few of his patients, they've gone in to look at a problem related, for example, to the knee and or to a wrist. And what they found out was there was some pain actually coming from the shoulder. And I know, like in Chinese medicine, there's a lot of connections between one part of the body and the other part of the body. What they're trying to do here is they're trying to figure out if something happening in one area that's actually showing up in another area that's causing the problem that's there. And that's related to a number of different treatments, not only from the standpoint of what the doctors prescribe from a pharma standpoint, or if we prescribe from a medical marijuana standpoint, but also it helps them be able to identify those conditions where you may want to use, for example, ice packs or things like that to relieve the swelling. I know sometimes when I go walk, and I walk a long distance, I had knee surgery a couple of years ago. I found that if I ice my knee, it helps quite a bit because it's just, I'm trying to help get rid of the inflammation. Again, there's an EMG, and the EMG is doing very much the same thing. What they're doing, they're trying to look at is what is the result the pain has on your body. Pain is one thing, but if it's increasing your heart rate, it's increasing your blood flow, putting pressure on your heart. Those are all things that we're trying to look at, or the doctors are trying to look at, to be able to see how this pain is affecting your overall health and your overall ability. Now, what's interesting, this is where also people get anxious and they get fearful. I know when you're in pain, you get protective. That's that fight or flight type of syndrome. And that's what they're looking for, is if you start, your anxiety level goes up, again, your heart rate will go up, things like that. We're looking for the overall profile of your health behavior in doing that assessment. That's what your doctors are looking for. That's what most doctors are trying to assess when they're looking for, especially in acute pain, they're trying to look at what's there. This has been the problem with chronic pain, because if it's coming from a number of different areas, from 2 or 3 areas, like I have inflammation in my knee and I may have an injury in my back, those are harder for the doctors to address because they're 2 different areas. But there may be a common culprit, and that common culprit might be inflammation. So by reducing the overall inflammation in your body, it helps in both of those particular areas. And I know the doctors are trying to be very scientific to look at where it's coming from, but I think what we're going to show you with medical cannabis is your body will be able to know what your problem is and where it's coming from. By the way, there are also different profiles these are all the profiles that the doctors are building to be able to try to look at the your sensory response to pain, which is pain stimulus and that type of thing. Again, a lot of this has to do with all the different tests that are being done out here, but what they're looking at is the amount of pain stimulus required to trigger the patient's response. In this particular case, what they're looking at is what your pain tolerance that's out there. And again, it affects your heart rate, it affects your fight or flight, so both physical and mental abilities. And the doctors are trying to figure out basically how bad it is that's out there. And I think this is very clinical, and I think it's very important, and I think it's very important to do. And that's something that you're pointing out. But also going back and being able to become more, so you look at some solutions, becoming more limber, being able to relax a little bit, being able to get your overall body health really helps quite a bit. I know that one of my bad habits is golf. And when I was getting back into playing golf as a senior citizen, I went to a golf pro that I knew, a very, very well-known pro on the PGA Tour, asked him what his secret to playing golf over the age of 50 was. And this is a guy who was very conservative. In fact, he was LDS. And I'm not saying the Mormons aren't, they're very conservative people. He looked at me and said, it's yoga. I almost fell on the floor. I just never pictured him as a yoga guy. I did try yoga for a while. I personally prefer Tai Chi because I found that this helps quite a bit. And I know that in the mornings, I'm talking about when I do my Tai Chi workout, I actually feel good. It starts my day. I feel a lot better. And the thing I like about Tai Chi is I'm able to go and do this when I'm, no matter where I am, if I'm traveling or not traveling, hotel rooms or whatever. I know we're not doing a lot of traveling with the quarantine right now, but something to take a look at as one of the options that's not just physical, it's not just pills, it's not just cannabis, but also the overall addressing your body, addressing addressing your body, addressing your flexibility, and exercising. Like use it or lose it is kind of the philosophy here. It's something to really take a look at, but that's something that's one of the conditions that are there. There's also a number of things when they talk about chronic conditions. Chronic pain requires long-term medications. There's no short-term medical effects. When they do the blockages and they do things like that, that'll work for a month, 3 months, maybe 4 months, maybe 6 months, but it's going to come back at the end of that time. And the biggest problem with the opioids is that what happens is that your body gets used to them, so you need more and more and more of them to be able to get to the same level, to the point where that's where you get the abuse and the addiction that comes into play. So you've got to be very careful about how the different conditions that are there, especially when you have chronic pain. You got to be able to get yourself into a situation where you're not becoming addicted to the medication, but you are in fact getting something that's really helping you quite a bit. Now, medical marijuana has turned out to be, in many cases, something that in the case of chronic pain has been something that doctors have recommended. I know the doctor that I went to, who initially 5 years ago when I was talking to him about my chronic pain, was very anti-medical marijuana. And I know today, since I've been working with him, he actually, for many of his patients, sends them to some of our clinics, sends them to some of our dispensaries, because he knows that it can help with a number of different situations. Again, chronic pain, ALS, whether it's multiple sclerosis, muscle cramps, different states, it's something that's there that people know medical cannabis can help you. Now, I'm going to play a video from Sanjay Gupta that can maybe explain a little bit about how all this works and why it works. I think this is important because it puts things in perspective as to why cannabis has become so important to addressing pain. In fact, more effective than a lot of the pharma drugs that are out there. Let me play this for you.
THC, which is a psychedelic component of cannabis, which makes you feel high. And then there is CBD, cannabidiol, the non-psychoactive chemical. We've told you about this one for years, especially how it stops chronic epileptic seizures in young children. There is also research showing that CBD is particularly helpful when it comes to pain. In fact, CBD can do something opioids cannot.
With opiates, you're talking about killing the pain, masking the pain, you're done.
Dr. Julie Holland edited the POC book, A Complete Guide to Cannabis.
With medical cannabis, you're actually not just talking about decreasing pain, but you're decreasing inflammation.
That's because opioids do a good job of interfering with pain signals going to the brain. But cannabis works on two receptors, one that blocks that pain and one that decreases inflammation. It's ironic that cannabis can do more than opioids, yet prescription opioids are legal and cannabis is not. Historically, that was not the case. For centuries, both cannabis and poppy, two plants, the natural forms of marijuana and opioids, were commonly prescribed by doctors and dispensed at pharmacies. But that all changed in the 1930s. Opioids would go on to become a best-selling drug, and cannabis became increasingly fringe, in part because one kind of cannabis, called hemp, was a threat to big business. Hemp is a cheap fiber, good for making paper and canvas. It's more absorbent than cotton and could be used as a potential fuel.
So there were a lot of vested interests that sort of put cannabis down, took it away from the doctors, made it illegal.
What's fascinating about this is prior to 1938, when this all happened, if you look at the pharmacology, if you were a doctor and you look at your book of pharmacology, almost 40% of the solutions or the remedies were cannabis based. So cannabis was very, very popular.
THC
was very, very popular, and really something that was used by quite a bit by doctors. And when they took that away, not for medical reasons, they took it away for more, let's just say, business oppression reasons. Doctors lost one of the key components they needed to address and help people. Now, the number one pain management reason for people going to get medical cannabis today is chronic pain. And it's reported that 62% of the medical marijuana users actually use it for chronic pain or actually have chronic pain. How does that compare to different alternatives? Well, when you take a look at opioid-based researches, obviously you've seen that there's been a lot more increases in the use of opioids. I know the government's trying to control it. I know the VA has done a great job of being able to just pump these opioids into the market. But we are losing, for example, 52 veterans a day. We are losing literally thousands of people a year from the opioid use. I do want to point out there's been no fatalities. No one has ever died from using medical cannabis. And yet medical cannabis is as effective, if not more effective, than using a lot of the pills that are out there. And also when you take a look at things like you take a look at your not just your aspirins, but also you take a look at the different pain management things that are out there. They can hurt your kidneys, they can hurt your GI. In other words, your gastrointestinal issues. These are things that can hurt you. Things like Tylenol really build the toxicity up, and it's something that hurts your liver, for example, going forward. Not if you take it just now and then, but for people that have chronic pain and people that have consistent pain who take it on a regular basis just to exist, this is the problem. A lot of the football players in the NFL 20 years ago, the NFL teams were handing out things like Tylenol. Literally, you could go, as you ran on the field, they had pills boxes or barrels that you could actually take and be able to help people with their pain. What they found out 5 years later and 6 years later, it was causing their bodies to have problems, kidney, liver, GI problems from a lot of the players that are out there. Now, what's interesting is there's been studies done, and the University of Davis did a clinical study, and what they found out was that low doses of medical cannabis reduces what they call neuropathy pain. And that's something that's very, very important. They've been able to show that in the cases of neuropathy or nerve-related pain, medical cannabis is extremely effective. Not only and I'll show you a little bit why it's doing that, because of the endocannabinoid system, but also being able to reduce the inflammation, which actually helps with the pain. Now, in the United States, it's hard to do a lot of studies because it's a Schedule I drug in the United States. McGill University, which is in Montreal, did a major study, and they were able to go out and look at not only the pain, but also how it relates to sleep. It also relates to anxiety and things like that. And what they found out was that this was something that was very, very effective in being able to address those issues where conventional therapies have also failed. More recently, last year, there was a study that was done. This study was done actually in Israel. And what it found out was that 80% of the participants found it effective to help them with their pain relief and also with insomnia. Now that's an 80% rate. If you take a look at a lot of the pharma research that's been done that's out there, if they get over 70%, they're dancing in the streets. This is something that's really, really interesting. I've seen a number of studies. In fact, one study that we looked at, it's just going to be published. It's not published yet, but it's going to be published. Showed they had over 2,000 patients in a pain management study, and they found that after 6 months, 93% of those patients ended up getting positive benefits from using medical cannabis. So the research is there. Unfortunately, the research is not being done in the United States. By the way, if you might ask, how did they do this in the University of Davis, which is in California? It was because the state of California actually sponsored this as part of a research study because of their medical marijuana program. So it was a very special program that was done. But again, when we look at Canada, we look at Europe, we look at, more importantly, Israel, we're finding very effective studies that are out there. How does it work? Well, your body produces what they call endocannabinoids. And those endocannabinoids are how your body addresses your pain, your pleasure, your appetite, your immune system, and your mood. Now, in certain cases, when your nervous system finds out that you have a problem, it tells your body that it needs to produce endocannabinoids, and your body then produces them. So what happens is you get into a situation where your body is producing these endocannabinoids, and it's been going in to help regulate the different appetite, pain, pleasure, sensation moods in your body. This is how your body regulates itself. It's called the endocannabinoid system. Now, you can also supplement that. You can also supplement that with plants. This is where cannabis comes into place: the buds, the tinctures, the extracts. In my case, I'm a senior citizen. I'm not producing as many endocannabinoids as I was before. And as I have pain, it doesn't hurt to be able to supplement and help my body be able to go forward and be able to help itself. And this is where the plant, this is where medical cannabis comes into play. It's just simply working with your body to produce the medicine it needs to be able to address what's there. Now, for those of you that have been around pain management and seen pain management, you'll see there's something called Marinol that's out there. And Marinol is a very effective pharma product, but it's a synthetic cannabis. It isn't the real thing. You can't necessarily reproduce an apple. You can't reproduce a banana. And that's what they tried to do with cannabis. Now, it was produced and it was used quite a bit, and doctors use it, but it's THC only. It's only one part of the cannabis plant. So what's happening is it doesn't necessarily have the effects that you want, but it is something that's out there, and it has been prescribed by doctors in certain situations. And I don't recommend using it at all unless you're under a very strict doctor's care. I bring it up because you'll maybe hear about it. There are people that have recommended it, but again, being a THC only product, be very, very careful of it, because it's something that is not going to necessarily help you moving forward. Again, your body produces its own endocannabinoids, and all you're doing is supplementing and helping it be able to move forward. Because your body is producing, because your body knows that you have a problem, it then produces the endocannabinoids, and it then sends it to your body. If you treat yourself, like for example, I had a knee surgery done. I had I had my knee replaced, and that was both acute pain as well as chronic pain moving forward, because the inflammation that comes into play is there. My body, I was taking medical cannabis for that, but I had another condition in my body. I was in an auto accident and I hurt herniated discs in my neck. But what I found out is by taking the cannabis for the neck pain, which happened 4 years ago, my knee surgery was 2 years ago, that medical cannabis that was helping my back got rid of the pain in my knee. And that's called the entourage effect. Your body knows where you need help, and it produces the endocannabinoids to be able to address that. Important, because it's being produced by your own body. That's one of the reasons why no one's ever died from medical cannabis. This isn't a foreign substance coming into your body. This is something that your body is producing to be able to address itself. And more importantly, because it's being driven by your nervous system, your brain, it knows where. You don't need medical instruments and all the research that doctors are doing. It knows where the problem is. It knows what it needs to fix it. And it goes out and it goes out and it helps you be able to address those particular issues. And when we see these different things here, like myrcene, pinene, you see chrysophyllene, these are all different terpenes that are in the cannabis that are designed to help with different issues that are out there. In fact, one of the things that's interesting is a lot of people have heard about aromatherapy. The same thing that's in aromatherapy, which are the smells and the different terpenes that are there, are also available in cannabis. And when you put those together with the CBD and the THC, it's almost like 1 and 1 is 3. That's where the power of CBD comes into place. That's where the power of cannabis comes into play. Now, important to understand, your body, when people talk about using medical cannabis, you have CB1 and you have CB2 receptors. CB1 receptors are primarily in the brain and the nervous system. CB2 receptors are mainly in the organs of your body and the soft tissues. What they do is those are receptors that are in your body that work hand in glove with your endocannabinoid system. In other words, cannabis fits these systems hand in glove, and they work very closely. A lot of people believe that when you take medical cannabis, it goes right in and it starts working with the CB1 and CB2 receptors. It does not do that. What it does is when your body takes in medical cannabis, that medical cannabis is then stored in your fatty acids. Your fatty when your nervous system says there's a problem, it triggers a number of different effects in your body. And so that's where the dopamine and those types of things come into play. and your body starts producing endocannabinoids. They pulls out of the fatty acids, takes those fatty acids and makes them long chain fatty acids. And from the long chain fatty acids, that then makes it the endocannabinoids, and it sends it to that part of the body. What's fascinating is that's where the entourage effect comes into play. Not only is it helping your body, maybe your knee problem, your back problem. I've had patients that took it for arthritis, and they had an arthritis problem. They were really trying to address the inflammation, and what they found out is the pain in their shoulder went away. And that was, again, because it was not only inflammation, was not only addressed by the reducing of inflammation and helped the shoulder, but also her body knew that she needed help with her shoulder, and that's what she did. So it's more like, think of your fatty acids as more like the batteries. And what cannabis is doing is it's being stored there and then being used by your neurons, your nervous system, to then go out and treat your body that's out there. Now, these receptors are all over your body. When I talked about the CV1 and the CV2 receptors, these are the different areas where they know that they're out there. There's a document which we'll post as following up this webinar. Will provide some information, some resources, and some reference material. One of them is it's a 77-page report. It's done by Normal. It takes every part of your body. It shows all the research that's been done. That's there. We'll get that posted for you. And it's very interesting where it breaks all these different areas down, shows the research that's been done, and shows how these particular areas are all addressed. So we know that these endocannabinoid systems control your body, and we know that medical cannabis helps your body regulate itself. Now, how do we know that? Because all these studies were not done in the United States. They were done in places like Israel. They were done in places like Germany, places like France, Spain, and that type of thing. Your endocannabinoid system really is, your cannabinoid system that's in your body really is the chemical that your body uses to function. And when this was found in actually 1940, the 1940s, it was something that was kind of overlooked until research is being done into medical cannabis. There hasn't been a lot of studies done here in the United States on the endocannabinoid system, but there's been a lot of studies been done in Europe, and especially in Israel. The United States government's been funding studies in studies in the medical cannabis since 1964. And the Israelis have published all of those studies in the National Institute of Health database. But what I'm trying to point out on this particular slide is that fewer studies are really showing that about especially the memory benefits that show that, fewer studies show the benefits of the memory function because they just haven't studied it, but they know that it helps. They know that it's there. And when I'm the first person to say that all those studies have been done, we need to do more of them. And in this country, we need to take the Schedule I drug marker away so that we can, in fact, go in and realize what this can do for people and how it can help people that's out there. More importantly, and this is a slide that was produced, or this is a study a graph that was produced by the CDC. Now, they did not produce this slide after 2014. I've been looking for it. And there's a lot of political reasons as to why that happened. When the pharma companies got in and tried to block this. But what's interesting is if you take a look at this blue line right here, this particular line is prescription opioids, which are being handed out mainly to veterans, but being handed out by doctors to be able to address pain. What they found out towards the end, getting in around 2010, is that the opioids are killing people. So the government started issuing regulations to cut back on the opioids. Something very key. If you have pain and you're taking a prescription drug for that, just because the government says you shouldn't be taking it doesn't mean that you're not in pain. This thing where, no offense, I'm not trying to be political, but when Jeff Sessions says, just take an aspirin, that's not the answer. If you have severe pain, like I have 7 herniated discs in my neck, that's severe pain. It's not going to go away with an aspirin, that's for sure. And in many cases, what happened here in the year 2010, when they started cutting back on the use of opioids, guess what increased? Use of heroin. That's this line that's right here. And that's where our heroin epidemic came into play today. Trying to just stop something without a solution isn't the answer, because people who are in pain are going to turn somewhere. And a lot of people say, well, these people that were heroin addicts, they're people on the street, they're whatever. I worked in Silicon Valley for 38 years. I was the president, vice president, director, and project manager during that time of a number of different people. In the last 10 years, I physically lived in California. I lost 8 employees to heroin. And these are not employees these were BMW driving executives with VP titles, director titles, that had families that had been in automobile accidents. More importantly, they had been veterans that had been hurt, they'd been lost a limb, or they had been, somehow had injuries from being a veteran. And when they started cutting back on the opioids, they had the pain and they couldn't work without getting rid of the pain. Hence why they turned to heroin. And this is why the problems that are out there. If we would have sat down and started looking at medical cannabis as an alternative over the years, we would have saved the lives and made the lives of thousands of people, not just the veterans, but also the people that have from injuries, but their families, a lot better. Again, we talked about going back to how it works. These are the receptors that are in your body right in here. And what your body is trying to do at this particular point in time is your body is trying to address how the neurons be able to trigger the electronic responses in your body that trigger your nerve pain and to trigger your senses. And so this is where sorry about that. This is where the THC, CBD, the cannabinoids come into play. They come into the CB1 and CB2 receptors, and that then gets into the neurotransmitters that be able to work throughout your body. This is a little technical, but I just wanted to let you know there is a physical process that goes on that they can measure and that they have been measuring. Again, the endocannabinoids are released, and that puts your body back into what they call homeostasis. Homeostasis is where your body is functioning and triggering the way it should be. And when the chains are broken, when the chains aren't working correctly, that's where the pain comes into play. And so what it's doing is it's helping to correct the connectors, the transmitters, the receptors in your body. It's helping to put it back into place, getting back into a normal signal, a normal signal that's out there that basically reduces the pain. That's where, for example, getting rid of the inflammation helps to be able to promote the signals and the homeostasis that's in your body. Now, when you look at medical cannabis, are all the components of medical cannabis. On the inside here are the different medical components to medical cannabis. There are, for example, they've been able to identify over 450 different medical components that address different conditions. That's what the outer side of the ring is right here, the different issues that are there. So we know in the medical cannabis field, we know that if you have pain and sleep problems, we know that there are certain types of medical cannabis that can address these types of problems that are here. And that's where we get into what I call the strains. That's where we get into the types of medical cannabis and the terpenes that help us be able to identify what's there. This is medical cannabis. And I say that because just like you have pharma drugs that go out and address different situations, we know that we have in cannabis, you hear about CBDs and THCs and CBNs, and I'm not going to get into all the CVs, whatevers, but I'm just trying to have you understand, we do know that if you go to a medical cannabis doctor, they can prescribe a certain type of cannabis that will address the issue that you have out there. And I found it interesting when I had when I first went to the dispensary the first time, this was when I had my auto injury, I went into a dispensary and they had literally hundreds of products on the shelf. It was kind of like walking into one of these Chinese, I don't know if you've ever been to one of these Chinese doctors. I come from the San Francisco Bay Area. They have all these boxes with all kinds of stuff in it. And you describe what your problem is and they turn around and say, here, take this. I couldn't figure out how they knew that. And then when I came in the second time, because I was kind of shy the first time I went in, I asked them, how do you know out of all your products what works? They said, based on your recommendation, they identified it down into what types of products. Based on that type of product, they'd recommend the product that works for them. And that's why working with your dispensary and working with your medical doctor, you can home right in on whether you have sleep apnea, whether you have migraines, whether you have pain, arthritis. They can tone in exactly what's out there and be able to address it. This is the importance of medical cannabis. This is something that's very, very, very important because the terpenes play a large role in this. Now, when I got involved in the industry 5 years ago, there was a lot of discussions about sativa and indica. Indica is a type of, it's actually the physical plant, the actual way it physically grows. And it's a shorter plant, it's got broader leaves. And what it does is it's more of a relaxing type of plant. When you look at the sativas, they're more narrow and they're a little taller type of plants. and they're more, they supposedly they were there for to be more active. But when I first started getting in this business, they talked about indicas and sativas. But what happened is, I'm going to go back for a second. When they started looking at these different types of components that were within medical cannabis, what they found out is when we started making medical cannabis, that what they were able to do is they were able to then take those and mix them together into what they call hybrids. And when you go into a dispensary, you'll hear about hybrids. The hybrids go in, and what they do is they will mix certain different those components that were there to address that particular situation. And then they'll also address the terpenes. And the terpenes are important because what the terpenes do is the terpenes help you focus right in on that particular condition. Bruce, I noticed that you just joined us. Can you hear us? Hello, Bruce?
Yeah, turn it down.
Yeah, there you are. Bruce, how you been? Bruce, are you there? So anyway, what I wanted to point out in this, Bruce, when you get connected and you hear us, let me know. We'll tune you in on this. But also, one of the things that's important to understand when you're looking at medical cannabis is that every person's body is a little bit different. Your biology is going to be different from the person that's next to you. This is not a situation where you take 2 aspirin and call me in the morning. This is a situation where the cannabis will have different impacts on your body. For example, my wife is very THC intolerant. THC doesn't bother me that much. But what you need to do is we have a thing called go low and go slow to try to figure out the types of medical cannabis that work for you, to try to figure out what doses work for you. That's where you need to have it work very closely. If you can get your dosing right, then it'll help you be able to address the particular situation that's there. And dosing means how much you take and what type you take that's out there. And that also has an effect because of the terpenes that are there. Different terpenes do different things, for example. Bruce, are you there? Bruce, can you hear us? Don't know if you can hear us. But anyway, what I'm trying to point out is that, so for example, pinene is something that'll help you. It smells like pine needles that are out there. The myrcene are there, they're mangoes type of things. They all have different medical components to them that help you go out and be able to address that particular situation that's there. If you want to relax, the linalool, which is lavender, that particular terpene in the cannabis will help you get into a more relaxing situation. If you're worried about memory retention and things like that, that's where pinenes come into play. Now that's the good news and the bad news, because pinenes, which help you with your memory retention, also if you're a PTSD patient, you want to stay away from pinenes because they can bring back memories that you just don't necessarily want to relive, and that's out there. Again, the mangoes, the myrcenes, the mangoes that are there, again, are more relaxing. Limonene is one that's very, very important because, again, it's something that helps address certain issues like a lot of the arthritises and the cancers and things like that. So I'm trying to point out that these terpenes are important. I'm not going to really dive too deeply into them. I just want you to know that they're there. I just want to let you know that each of these has a particular reason that it's there, whether it's stress relief, whether it's helping you be more sedated, whether it's helping you with mood, it's helping you with memory. It's all there to be able to it's all there. And that's how the people in the dispensaries know which product to provide you to be able to address your particular situation. And you yourself can take a look at trying different things, whether you're looking at trying to address anxiety, with mood, pain, asthma, things like that. There are different products that can be able to help do that. Bruce, are you ready to join us? Hello, Bruce? We lost old Bruce here for a second. So, I don't know, Bruce, can you hear us? Okay, anyway, but I'm trying, this is the chart. Again, as a follow-up to this webinar, you'll get a copy of this presentation. We're gonna give you a page to give you a video, a place where you can see the video of this presentation. Also, you'll get a copy of the presentation. And then we have a number of notes, like I mentioned, that one document from Normal. And we have some reference notes you can take a look at to help you drive down and learn more about this particular situation. What's really interesting about medical cannabis is there's a couple of different things like Delta 8 and Delta 9 that are very, very effective.
They're almost done. I think I don't know, they can see me, but.
Oh, we can see you, Bruce. We actually slides. You want to talk about Delta 8 and Delta 9? Bruce, you there? So anyway, the Delta 8 and Delta 9 is very, very effective in addressing pain and being able to go
Most
forward.
of
The
the
interesting
slide
thing
deck
is
is
Delta 9, which is very THC based, you have to be careful with it because it can get you high. But Delta 8 is almost as effective for pain management without necessarily getting as high. So it's something that's out there, and you can talk to your dispensaries and they'll be able to provide products and point you in the area of products that can be able to address a lot of this. Bruce, you want to make some comments? We'll see what's going on. Okay. Now, one of the questions that comes up is, I know when I got involved in the business, a lot of people said, again, this was 5-6 years ago. I didn't see a lot of people smoking joints and sitting on the side. I came from a world that that's what they did when I was younger. But what I found out, the medical cannabis business has progressed a lot further on this area than a lot of other people. So for example, one of the most popular ways people take medical cannabis today is with what they call sublingual drops. This is drops they put underneath your tongue. And so by putting it underneath your tongue, those drops get absorbed directly into your bloodstream almost immediately. It takes about 15 to 40 minutes to work, depending on who you are. It takes me about 20 to 25 minutes. I take sublingual drops every morning. As I mentioned, I have 7 herniated discs in my neck. I have 2 herniated discs in my back, and I have recovering from a knee surgery. And I know it takes me about 25, 30 minutes before the sublingual drops work. But they last for 4 to 6 hours, which is great. Now, what do I do when I get up in the morning and I'm in a level of pain of 7 or an 8, which is what I'm in? How do I get rid of the pain? Well, I also take a couple hits off a vape pen. And literally, almost immediately, the pain goes away from a vape pen. It's amazing what it does. And the first time I did this, I said to my wife, this is crazy. I mean, I just felt it was almost like somebody wiped my back and the pain went away. And even this morning when I did it, it's just amazing to me how all this works. But you can mix and match your dosing forms. In my particular case, I take something in the morning, I take something in midday, and I take something at the end of the day. Because again, my pain, if you notice the times that these works, which is 4 to 6 hours, I want to be able to have something that addresses my pain and helps me as it goes on throughout the day. Because again, I have a high level of pain, and if I don't address it, I get into pain. Vape pens are inhalations. And so this vapor that you put into your lungs, people may not want to use vape pens. That's understandable. You can also take capsules. Remember the old famous capsules that are there? You can actually put it in your capsules. What's interesting about the capsules is that goes into your stomach. It's then broken down and absorbed by your digestive system. So fundamentally, somewhere around 25% to 30% of the product that goes into your stomach gets absorbed by the stomach and it's not sent into your body to be able to help you address your particular medical condition. So you typically have to take a little more of the capsule than you would with a sublingual drop, and that's why people prefer the sublingual drops. But if you don't like taking the sublingual drops, or it's something that's difficult for you to do, you have capsules that are out there. We've had edibles is something that have been there, and now they're legal here in Florida. And I have to tell you, edibles are very, very popular. These are the famous gummies, the brownies, the dots, the cookies. It takes 15 to 40 minutes to work like the sublingual drops. They're very effective, 4 to 6 hours. My mother, who is in her 90s, was diagnosed with breast cancer when she was 88. We used medical cannabis and actually put her into remission. She didn't go through chemo or radiation. She basically has been using medical cannabis, but she carries her little edibles with her. She carries her gummies with her. And when she's out and she's moving around, she actually will take some of those. And that's her regime. She has a regime that works 3 times a day as well. And I'm just saying the edibles are very effective. Now, good news and bad news. They're very effective. They take 15 to 40 minutes to work. Let them work before you take them again. There's the famous stories of people who get the brownies. They say take a quarter of the brownie to start. It didn't work in 5 minutes, so they ate the whole brownie. Next thing they know, an hour later or 2 hours later, they're high. It's because they've overdosed from taking too much of it.
Mark, can I inject one point here? I apologize, I'm late. This is Dr. Rubinowicz.
Yeah.
The other issue with edibles, especially when it comes to Delta 9 THC or even potentially Delta 8 THC, which I learned the hard way myself recently, not only do you end up with more, but one of the things you actually end up with a higher concentration of a psychoactive component of THC, because of the way it's metabolized through the liver, gets hydroxylized, and what you end up with is much, much, much more psychoactive, for lack of a better word, version of THC. So you actually end up with a whole lot more, and like I said, it ends up sticking around forever. So it becomes very difficult to undo that mistake.
Yeah.
So there's two things that drive that.
Yeah, I mean, we got some edible. Candidly, we got for my mother who did not like to take the drops, did not want to vape. We got her some edibles. We got her a couple of brownies. We told her to take a quarter of the brownie. Now I have a nice Portuguese Italian mother who is very energetic, even at the age of 90. After 5 minutes, when it didn't work, she ate the rest of the brownie, and then after 10 minutes, when it didn't work, she ate the second brownie. She ended up calling me up saying, I feel really good, Mark, what's going on? And interesting part was I had my brother go over and talk to her, and she called me back and said, Mom's baked. Mom ate almost all the brownies. So just be careful, because just like a pharma drug, these are effective and these will affect you. So all I'm saying is be careful when you use these things. It takes 15 to 40 minutes to work, give them time to work, but they're very effective that are out there. That's safe to say, Bruce?
Yeah, I mean, I think the real benefit, like you said, is that you don't have to dose all the time. To me, I mean, the way I recommend it for patients is first get an idea how much you might potentially need by I mean, for me, I call it microdosing, say with a vape, where you can get a much better idea how much you might need, or even maybe a sublingual. But you have to have an idea how much you're going to potentially need, to me, before you jump right in and use an edible, because like you said, you never really know how long it's going to take to hit, and then you overshoot the dosage, and you're going to regret it. And unfortunately, you're going to regret it for several hours, and it could be quite unpleasant if that's how it potentially affects you.
Right, right. Now, another issue that comes into play, some of the other ways of using it are what they call topicals. This is where you actually rub that on your skin, and it goes down into your body, and it works for, again, it's almost like the vape pen, it works for immediate relief. And topicals are very, very effective. You will hear a term called transdermal, you'll hear transdermal, and you'll hear about products. There's a couple of products on the market that go right into your bloodstream. They're topicals that go right into your bloodstream. Move, for example, Cetera, TrueLeave, all have products that do that. They're very, very effective. This is much better than a lot of the CBD products that you find that are out there. And those products work immediately, and they help. I know that when I had my knee surgery, and I was trying to help myself with pain, I use topicals quite a bit. And I know sometimes when I go out and I play golf right now, I'll use the topicals before, and I'll use the topicals after I play, mainly just as a preventative situation to address the pain that might be there. Another way of dosing or using it is what's called a transdermal patch. This is a patch that you put on your body, and what it does is it'll last for anywhere from 10 minutes all the way to, it'll take about 10 minutes to an hour to work. It'll work from 8 to 72 hours. And you can put it on the back of your neck, you can put it on the inside of your thigh, you put it in the inside of your arm. And the nice part about transdermal patches is that when you put it on, it usually takes about 30 minutes to work. But if you're starting to get a negative effect from it, you can take the transdermal patch off. It's the only way of dosing that you can actually stop. You can take the patch off, and literally within 30 minutes, you're back to the state you were before you started. So when you start out, using transdermal patches is not a bad way to help you. We recommend going low and going slow to find out what your dosing level is, to find out what helps you. It's actually a pretty good way. It's one of the mechanisms to be able to help you with that. Bruce, do you have experience with transdermal patches?
I haven't had a lot of folks that use them. I strongly recommend them for folks, especially given the topic, which is chronic pain. So, ideally, you don't want to have to be taking something all the time. And that's an advantage where you're also going to get a much more steady, stable dose throughout the day. So it's really an optimal dose. It's an ideal delivery system, especially to try to get THC in your system, because you can mitigate the psychoactive effect of it, because you just generally don't absorb as much, and you don't end up with all the conversion to a highly psychoactive form of the THC because it's not going through, you're not getting the hepatic metabolism, plus you just don't get as much, so it tends not to be as psychoactive, but you really can get a good steady dose, effective dose, and kind of, kind of maintain a good stable level, level of ideally therapeutic intervention with this CBD, THC, whatever it is you're using in your system. So it's a really good delivery system.
Yeah, the actual patches look something like this. These are the patches that I have, that I use. I don't know if I can see them with the, I'm doing one of these Zoom background things. And there's a CBD version, a 1-to-1 version, and a THC version. I use the CBDs and 1-to-1s all the time. The one I use lasts 72 hours. And the reason I use it is because I can put it on and I don't have to worry about dosing constantly. I know that it's there. And like Bruce said, it gives me the administration that I need. And I don't have, it just makes it easier for me to use my medical cannabis without having to without taking things all the time. And they're very effective. And as I mentioned, if you're just getting into it, if you're new to it, it's something that you can take off if you start having a negative reaction to it. There's also sprays. And a lot of people ask me, what are sprays for? Those are really initially designed for kids, for the epileptic patients. So you could actually, if kids are having a seizure, they could actually use the spray to be able to help. I know they've been used for a number of different things that are out there, but they're very, very popular. Again, especially with the adolescent markets. Bruce, any comments on sprays that you've seen?
Well, I think the advantage of the spray is also you know your dose. I mean, I think one of the challenges, especially with like sublinguals, is that people can't dose exactly. So the ideal is that ideally these are metered dose, so you're getting a fixed dose, and so I think it's a good way to kind of be more consistent with the dosing. I think it's again a good delivery system as well. But I think that's, to me, probably the main advantage.
Sure, it's there. And I know that there are folks that just love flower. I mean, I'm in my 60s. I grew up with people that use flower. I wasn't necessarily using it that much, but there's a lot of people that just prefer to use it. And that's now available here in the state of Florida. Your medical, tell your doctor that that's what you'd like to use as a route of administration. And you can get flower from, in fact, all the dispensaries right now. I was talking to a couple of dispensaries, and they were mentioning to me that it's literally, usually it's coming up to be almost 30 to 50% of the products now being sold here in Florida are flower. It's there. So, so you go down here. Let's see. Then we have shatter and crumble. Right now, I don't recommend taking a look for you at shatter and crumble unless you're an advanced user for cannabis. These are pens that you put. These are pens like this that you put the product into. The reason that you use them is because they give you, it helps you adjust the dosage that's there. It helps you be able to address it. But again, if you haven't had experience with medical cannabis, you don't know your dosing levels, you don't know what types of products to use, I don't recommend them. But after you've used cannabis for a while, it's a very cost-effective way of using medical cannabis. A lot of it's been developed, again, for the cost factors that are out there. Bruce, any comments on that area?
No, I agree. I think there's two challenges. One, it's very concentrated, so you're going to get a real kick in the pants. And I think unless you really know what you're doing, it's really easy to overdose on the THC. But for some people, I think that, to me, I mean, I would gear folks towards that. People that were really, they'd like to use flower, they like the feel of, they really want the whole flower experience, and I think that's as close as you're going to get with a medical marijuana non-flower product. But they're pretty potent, and so I think you have to have some experience and really know how you're going to feel when you do a THC product before you start. I mean, I don't think you want to just jumping into the deep end of the pool.
Yeah, but again, they're there. We want you to know that they're there. It's something that just don't jump into right away, but it's something that again, there are different administration routes that are out there. I know we got a chat comment by Jessica Cook, and I want to read it to you because it says, I use it to treat my chronic pain back from I can't even pronounce that word. I can't pronounce it, but she has a chronic back issue. She says, I got my medical cannabis card here in Florida about 6 months ago, and it's nice to get off the painkillers. So there's a little bit of a testimonial by someone who's watching this, that this stuff does work. And I can tell you as a user, I could not do my business. I could not function on a daily basis without medical cannabis. Bruce, you want to talk about how to get a medical cannabis card? So if I decide to go down this route, how do I get a card?
Well, I mean, in the state of Florida, you have to be seen by a physician that is been certified to provide medical marijuana certification, or approved by the state, and a credential with the state to be able to provide medical marijuana certifications. You do need to be seen in person, and you do have to have a qualifying medical condition. The state has what appears to be a somewhat restrictive list, but it does have some flexibility, but you do have to have a qualifying medical condition. Pain is not a qualifying medical condition, although lots of people are actually certified for chronic pain, but it's actually not a standalone approved condition. But for most people, they can get approved. They do offer what are called like and kind conditions. So you can see the list of conditions: HIV/AIDS, PTSD, cancer, Crohn's, Parkinson's, terminal conditions, ALS, epilepsy. The chronic non-malignant pain is really essentially a condition that is secondary to one of the other listed conditions, which seems kind of silly, because if you have one of the other listed conditions, then you don't need the chronic malignant pain. I'm not sure I understand the logic of it, but I'm sure there is some. Multiple sclerosis is also a condition, but they do allow like and kind conditions. So the point, the purpose of what medical marijuana, it's not approved for treating any medical condition, but it is approved for treating symptoms associated with these medical conditions. So if somebody has a underlying condition that has symptoms similar to one of the approved conditions, so for most, anxiety, mood disorder can fall under PTSD, irritable bowel syndrome can fall under Crohn's disease. There's muscle stiffness, rigidity can fall under Parkinson's disease. So there, even chronic back issues can fall under like and kind conditions, because most people have symptoms that are associated with the other qualifying conditions. So just if you don't have a condition that's listed, doesn't mean you can't get certified. Most everybody is certified. I mean, the way the program is set up is if the physician has deemed that you're qualified and you have if they're comfortable and you have a documentation of a medical condition, then they submit the application. The only time a patient won't get approved if there's an issue with their license or residency, or some error was done with putting the application. So people don't get denied typically, or that I've ever had experience, because of the qualifying conditions weren't justifiable. So
I think that Florida, when they initially brought their law, they brought up 12 qualifying conditions, and then they did something that's right. They started seeing other qualifying conditions that really apply to medical cannabis. In fact, they ended up, in talking to some of the people up in Tallahassee, they found out that there's probably over 300 different medical conditions that you could qualify for medical cannabis. And they just keep pumping out different lists and different numbers out there. They decided to leave it up to the doctor. They did something right. They said, we'll leave it to the doctor. If the doctor sees a like condition, then they can qualify the patient for medical cannabis. And that's why they have a doctor make that determination. And that's why medical doctors are important in this whole process of getting medical cannabis. You can make the right decision. You know what the person has, it doesn't have. You know if they need it or not. And then you know the different conditions that are out there. So they've basically let it up to the medical professional. They've let science, the professionals that know the science, be able to make that decision. And again, as a doctor, you're also there to verify that they have that particular condition as well. That's out there. And when you find someone that if you do qualify, then they place you in what they call the registry, right?
Yeah, so you basically get placed. The state has a central registry. All your information goes in the registry. Application goes through the registry. They verify that you are a resident using your driver's license. And once the state approves the application, you're able to go purchase. A qualifying physician is able to enter basically orders for 210 days. You get 3 70-day orders. You get separate orders for basically low THC products, predominantly CBD predominant products, and you get a separate order for high THC products, and then orders go in individually for different delivery systems for vape, topicals, sublinguals, now edibles. Most physicians will put in the orders for 3 orders of 70 days. So you get 3 70-day orders. So you'll get 210 days worth of orders. State requires that you're seen in person to renew those orders within 210 days. So there's two time limited things going on at the same time. You have your card, which is basically your license. It allows you to go into a dispensary and purchase. That is on a yearly cycle. That has to be renewed. You do that on your own through the registry yourself. Physicians, depending on who you see, they may help you with it. I typically help patients with doing that. And then you have your orders. The orders are the 210 days, and that requires you are required to be seen in person every 210 days or sooner to renew your orders. So as you can see, the card and the orders will not always renew on the same cycle. So it can be very confusing for most people, and understandably so. So you do have to kind of keep track of it. But it's not the end of the world. If your card expires, you just resubmit a renewal and it'll renew. So even if it expires, the only issue is if the card expires, you can't go in to purchase anything. They won't fill any of your orders. If your orders expire, but your card is still active, you go into the dispensary and they will just tell you, you don't have any orders.
So a lot of people are going to go, I'm confused at what happened. So let me clarify what that means. My medical, when I went in and I got my medical, when I went in and did my visit, I did a visit with the doctor, and he actually put the recommendation into the registry, which was great. And when I got my card, which was almost 4 years ago, there was quite a delay between the time that you got put into the registry and then you physically got your card. And so, for example, my card runs from basically July to July. And so typically 6 months after my July date, I typically go in and get the second half of the year done. But it turns out that my recommendations runs from October to October because of that delay that was in there, is what I'm trying to point out. So that's where the state hasn't synced that up yet. And unfortunately, especially for those of us that got our cards years ago, there is a delay sometimes between the two. And it's just something to pay attention to. I know that your doctor, your MMTC doctor, will pay attention. They actually track the day you have your card is due and the day that your what they call your recommendation is due. But it's something to pay attention to. Not complicated. It's something that's there. But that's why that happens. It's just a matter of syncing up. It would be great if the day you got into the registry, they started the clock then and you got your card that way. It's like a driver's license, but unfortunately, there's a delay to physically get it there. I think the delay now is about 2 weeks. That's much better than it was before. But like I mentioned, in my case, there was a couple months that came into play. And that's what that's all about. So there's a question, by the way, please feel free to ask questions and we'll answer those. One of the questions that Michael brought up, so I'm going to read Michael's question if you don't mind, and Bruce, maybe you can help me with this. It says, dispensary associates recommend strains to patients based on symptoms the patient describes. How is it possible to determine the properties and specific strains that will target these symptoms, especially when strains impact people differently? That's a good question. That's an excellent question. And thank you for bringing it up, Michael. And what you've really done is if I want to break this down into really 3 different parts, because it's important to understand how this whole process works. The dispensary personnel, when Bruce puts a patient into the medical marijuana registry, he also puts in a recommendation of what they should be taking. Usually the dispensary associates look at that recommendation and they recommend based on that recommendation. Now they do listen to the patients. There's no question about that. They don't, they do listen to what's out there, but the basis for what they're recommending comes from the doctor and the recommendation, not necessarily just from the patient itself. Although again, they do listen to the patients to make sure they're addressing their particular issues that are there. So it's not just based on what a patient doesn't walk in and say, gee, I think I want to do this. The patient walks in and says, I have pain, I'm trying to manage it. What do you have to be able to help me in that particular area? Is that safe to say, Bruce?
Yeah, I think, but I actually, I think he asked actually the perfect question, and he actually answered it himself as well, which you're correct. You can't. I personally did a little bit differently, and part of it was, I guess there's different ways to look at it, and things are becoming a little bit more liberal, I guess, not liberal politically, but liberal socially, in that generally speaking, and if you look at it strictly, this isn't really a prescription. So you really legally, as a physician, federally, obviously, you're not prescribing. And that's why the physicians, that's why the role of the certifying physician is intentionally very kind of hands-offy. And that is that this is really a patient-driven process. I think depending on the physicians, and I think there's some physicians that probably do little to nothing and some that do a whole lot. But generally, I never really put in really strict recommendations for two reasons. One is that the more specific the recommendations are, the closer you potentially can get to prescribing. So if the government, this federal government, decides they want to hammer down on this, although obviously at this point they likely won't, you can still get a little bit sideways with them. But the other is to the answer, that is that it's hard to predict individually how any patient will respond. So I think when you go to the dispensaries, if you have a good qualified bud tender, somebody with good experience. Now, a lot of times I would often recommend specific people as long as they were there at certain dispensaries, because I knew that they would take care of patients. They generally have an idea how most of the people will respond to a given strain, but it is very individual. So it is a lot of trial and error. So, that's why another reason why you don't want to necessarily go in and maybe do an edible right away, because you don't know how you're going to react. If you can tolerate vaping, it's a good way to try different strains and really have an idea how it's going to affect you. Plus, you can do the small doses, 1 or 2 inhalations at a time, and kind of work up, and you can sample different products. For some people, it could take a lot of time as they try to figure out what works for them. I mean, you can have some general expectations. Most of the indica type strains tend to make people a little more sleepy, can be a little more helpful with pain, a little bit more helpful with muscle stiffness type things. But typically, most people have to be cautious doing an indica strain during the day. Sativa strains tend to work a little bit better during the day, tend to not result in that kind of that couch lock effect. But it won't be the same way for everybody. So it is some trial and error. So to your point and your question, yes, somebody can give you some suggestions. I often directed people a certain way, but it is trial and error, and you just have to kind of see how you're going to react personally to any specific strain. But pay attention. That requires that when you go in, pay attention to what you're buying, see what the strain you're buying is. It really, if you really want to get nuanced, you can actually look more deeply into the strain and actually see what's in it. Look at that as he went over those terpene profiles. That's what's going to make the strain characteristics, or those terpene profiles. Pay attention. And you have to kind of really look closely at them to see what you're getting. And so that way you can, make it a little bit easier as you move forward, picking out specific strains for specific
The
issues.
budtender should be able to decipher based on your condition which terpene levels and strains to use. But it's good for you to know your terpenes. We'll provide you the chart on terpenes that you can have, and also that round wheel that will be that'll be in the follow-up. So keep that with you, because that'll help you look at what you're looking at and be able to know exactly what you're buying. It's important to be able to feel comfortable that you're in that particular situation. One of the other issues that's brought up in this question is how can you determine the properties of the different strains? Well, if you look at that wheel that's out there, they've done a lot of research. I know I deal a lot with the Israelis, and the Israelis have, since 1964, the United States government has been funding research into medical cannabis in Israel. And I say that again, your tax money and my tax money has been funding research into medical cannabis in Israel since 1964. And they've built a whole Israeli medical cannabis industry. This is the epicenter of medical cannabis. Well, they made it Schedule 1 in the United States. We were building an industry out of Israel, and they've done thousands of studies. And so they've been able to know that this study, this combination of cannabinoids, that's where the hybrids come into play. If they mix a little of this and a little of that for that particular condition, they know it addresses that, and they've studied that, okay, that's out there. And that's where those wheels come from, and that's where the terpenes, they know the terpenes put in there are actually out there. But it's something that they will know that they can target that, because again, if you look at that little wheel, they'll say, I have a particular condition. You can follow that right back to the actual strain and back to the terpene that's ideal to help you there. Now that opens up the door of how much do I take? In other words, do I take 25 milliliters, 50 milliliters, 100 milliliters? How much do I actually take? And that's one issue. And then the other issue is how many times a day do I take it? So it's quantity and quality. It's kind of like a fire hose. How thick or thin is the hose and how much pressure is going through it. That's the dosing that you've got to work out on your own. And that's something where we say go low and go slow. Most people start with a 1-to-1. They usually take a little bit of it, like 25 milliliters. Usually if it works, it doesn't work. If it doesn't work, talk to your doctor, talk to your dispensary. They'll actually recommend either increasing the amount, maybe go to 50 milliliters, or taking it twice a day versus once a day. So that's where you build up to find out what your tolerance is and find out what works. The worst thing you can do is to start taking it and it doesn't work and you stop. Because what you haven't done is you haven't found the sweet spot. You haven't found that dosing sweet spot. Trust me, when you find it, and I'm talking about pain. Look, I wake up in the mornings. Well, I don't wake up anymore. I figured out how to get rid of night pain now. But when I used to wake up in the morning with a pain level of 7 or an 8, that's not fun. It is just not fun. And when I figured out how to get my pain level down to less than a 1 in less than 3 minutes, it was Christmas. I got my life back, best way of putting it. And I've been able to fine tune it from there. If you can get to that and you can get to that situation by working with your pharmacy and working with your medical marijuana doctor, you can be able to do that. Now you're going to say, how do I talk to my doctor? Because obviously doctors like Rubinowicz, they're busy and they're in their offices. I work with MMTC. The reason I work with MMTC is because they have a dosing center. I can pick up the phone, I can call them, I have a practitioner on the line, and they help me figure out my dosing. When I had my knee operation, which is something that was unique, I work with Jewett Orthopedic here in Orlando, very well-known orthopedic surgeon area. They do about 60,000 knees a year, and they wanted to look at medical cannabis as an alternative. I worked with them. I worked with my doctor at that time, and I also worked with a dispensary. Then we actually it took us about 2 weeks to get the dosing right, but after 2 weeks, I was down to a pain level. In fact, walking out of the hospital, I was down to a pain level of 1, but I was able to fine tune the products and not overdose or whatever to get myself to a point where I was able to live my life comfortably. And I know that, and how I know that it worked was because they told me every 6 to 8 weeks to stop taking it for a day, just to help your body, so your body doesn't get used to it, and your endocannabinoid system doesn't get lazy and works. If I stop for about a day or a day and a half to just be able to get my body used to it, I'm not addicted to cannabis, but I'm addicted to getting rid of the pain. And that pain comes back and lets me know it's there. And when that happens, I know I need my cannabis to be able to address it. I got my life back by doing it. And I know a lot of people, I've dealt with a lot of people that does the same way. It's something to really pay attention to. And I think that's important. And what I'm trying to point out, to go back to Michael's question, Michael, work with your bud tender, work with your doctor, especially you have the right dispensaries. They will help you be able to address that. Now, there was another question that was brought up by Den. Den says, I'm confused with all the dispensaries in the area. How do I know which one's products work best for me? That is an excellent question. In this series, this medical marijuana awareness series, this particular fall, we've added 5 webinars. So next week is going to be a web. So we actually are presenting and giving you the opportunity to sit at home and talk to the dispensaries and find out what they do, how they do it, and what they can do for you. 2 weeks, next week is True Leave. 2 weeks after that is Harvest. 2 weeks after that is Move. 2 weeks after that is Cetera. And 2 weeks after that is Columbia Care. So we have 5 dispensaries that you can be able to talk to the people from those dispensaries. They'll tell you what they do. It's a seed to shelf business. They'll tell you how they grow it. They'll tell you how they process it. They'll tell you why them, what their advantages are over the other, because each of them do something well. And I think it's important that you can be able to see that. And so we're trying to address that question right there for you, Den, of being able to find out, to remove that confusion and being able to get the answers for that. So please tune in to these webinars. They'll be able to help you. But the answer is that each of these webinars, you're right, you don't want to necessarily go out and try a bunch of these things. I know there are dispensaries like Grow Healthy, for example, and what they do is Grow Healthy and Curaleaf actually produce a very small bottle of it. It costs $10 to $12, and you can try that without having the whole bottle itself. So you can try it initially and find out what works and what doesn't work. So ask your dispensary when you meet with them if they have a starter set or something that's there. And the other thing is, as a new patient, almost every one of the dispensaries offer huge discounts off your first order to be able to reduce the impact of that first buy to make sure you're getting the right products. And a lot of dispensaries like Truly will actually take the product back if it doesn't work for you or and exchange it for you. So there are ways of doing that. Again, talk to your dispensary, talk to your MMTC doctor or your dosing center, and they'll be able to help you quite a bit with it.
Can I just to make, I think the True Leaf is an important point to point out, that being able to exchange products, which is a nice option to have, especially to try different things, but also to make things a little more complicated, not intending to, but it's not the end of you're not at the end of your rope if for some reason you can't seem to tolerate the THC, and not everybody does. I've had many patients that they just can't. Certainly they're limited because they can't vape, and some places there may be limited options if you're not vaping or smoking for getting THC products, or people just can't tolerate it because it's just too psychoactive and it's unpleasant. The CBD world, and this is one thing we'll be talking more about. Hopefully I'll have the opportunity myself.
Actually, between the True Leaf presentation is CBD, and I think Bruce, you're helping me on that one, right?
Yeah. So the thing with the CBD, there's more than just CBD. The world things are really evolving, and there's a lot of new CBG products that can be very effective for inflammation, pain. There are CBN products, which I can tell you from personal experience are very good for sleep. There are Delta 8. These are hemp-derived Delta 8 THC products, and with the Delta 8 THC, you're getting the benefit of stimulating both CB1 receptor, CB2 receptors, like a Delta 9 THC, but significantly less psychoactive. But these are other options and avenues to find relief. So it doesn't necessarily end with what you might be able to find through the dispensaries, although there's obviously tons of options. This isn't like McDonald's franchises all over South Florida. Not everybody serving Big Macs, French fries, and a fillet of fish. Everybody has something a little bit different to offer. And some people love one dispensary, some love another. You might find one product that works well for you during the day at one dispensary, something that works well for you at night at another. So you do have to have some patience with it as well. And again, don't undervalue the potential benefit of just even the CBD products. The CBD marketplace is getting much better. Product quality is much better. State of Florida is regulating it, especially for products that are made and sold in Florida. So you're not going to be necessarily subjected to products that don't have that are good quality products. But there are a lot of options, and it's going to continue to grow. No pun intended, but it's going to continue.
And to that point, Bruce, this is a Delta 8 product. It's a CBD, hemp-based CBD product that I got from a friend of mine. I got it about 8 months ago when he helped me with my inflammation and CBD. He's out of California, so it's hemp-based, so he could send that to me. And I just want to this is what you're talking about. These kind of products are now going to be available here in Florida, and you don't necessarily need a card to get them. Is that right, Bruce?
You don't need a card to get them. We have one. We have a product line. We carry. We have gummies that are infused with CBD, CBG, Delta 8. And I can tell you from personal experience, you take enough Delta 8, you're going to know it. I mean, it'll hit you.
Well, you have to be careful with it. But the point is, they're there, and they're products.
But it works. The point being that these products work work very well. Doesn't work for everybody. These aren't, no, you know, not, there is nothing, there isn't any medical intervention that's, well, there's only one medical intervention that's 100% effective, and that's assisted suicide. Other than that, there isn't a medical intervention that's 100% effective. So you just have to understand that you know, even prescription medicines that are approved, you know, thresholds are very low, 50% response rate, and not necessarily 50% response rate with 100% relief of the endpoint of a study, you know, reaches the benchmark for an FDA approval. So just have some realistic expectations going in as well,
Right.
which is really important. And I tell people that they have to understand that.
By the way, yeah, this product can't, the reason I got it, I wanted to get more of it. And that's why I'm excited about trying your product, Bruce, because it does work, but it's coming out of California. So it's a bit of a pain in the tail to get. So I get it here in Florida, I'll be much happier. I want to switch topics just for a second. Den asked a question for these webinars that are coming up on the dispensaries themselves, which I highly recommend you take a look at. You're going to learn a lot. I've gone through a lot of the, I shouldn't say a lot, I've gone through quite a few of the Florida grow facilities and talked to the dispensaries themselves. It's absolutely fascinating. I learned a lot about it that helped me figure out what I should be using to help me with my particular condition. If you go to the same place you registered for this webinar, Marijuana Aware, you'll find that there's going to be one of the little boxes is to sign up for for example, the True Leave or the Move or the CBD webinars. And please join us for those. I think you'll find them quite informative. And I think, Bruce, the CBD one coming up should be quite interesting for you to delve into that world and for people to learn more about it.
And hopefully I'll be there on time.
Okay. That would be
no
great.
guarantees though.
Yeah. Stay away from airplanes.
Yes.
Stay away from airplanes. So I'm going to wrap up. We mentioned hemp, CBD, marijuana. I think it's interesting. A lot of the CBD products, the hemp products you can get over the counter, they have very low THC level contents. And so you can buy them without a license. The other cannabis products, you probably hear of sativa, indicas, and you're probably going to hear more about hybrids than you were about sativa and indicas. Hybrids have become very popular. It answers the question that was asked by Michael, how do they know what works? Because they know that hybrid has been blended for that particular product. I kind of liken it to whiskey. You know, they're kind of blending these things together to get the flavor that you want to get to help you adjust the medical condition that's out there. So I've covered a lot of everything I wanted to cover. Bruce, is there anything you wanted to cover?
Well, I didn't know how much of the baseline. I know there was some slides in here that were a little more technical with some information that maybe you weren't familiar with, because not many people are. The one point I want to make, and hopefully you made it, I apologize I missed it, is that for people that do have chronic pain is to really understand what pain is. And I think most people really start to focus on what are really ultimately structural issues. I mean, most everybody that I talk, when they talk about having a pain issue, and most of it usually neck and low back type things, and they'll say, oh, you know, I have a herniated disc, or I have, I mean, everybody has a herniated disc, or everybody says they have sciatica. Is that the point is that those are structural abnormalities, anomalies. If you actually did imaging of the general population above even 60 years of age, the prevalence of herniated discs, bulging discs is in the 80% range. So if I really wanted to be a very successful, and I mean successful, financially successful spine surgeon, all I would really need to do is to do an MRI of everybody that came into my office and recommend surgery on everybody that came in my office. And I can assure you there are probably people out there that do that. You're addressing structural changes. You know, pain, these are just anatomical differences. The spinal, the spinal cord, the spinal column, these aren't pain sensitive structures. The muscles, the tendons, the ligaments, those are the pain sensitive structures. So your pain is often originating from those factors. The other components are basically psychological components. I'm not telling everybody's crazy and they're just imagining pain. It's just that they're stressed. And the best example I can give people is how is it that on Sunday, your favorite football player is on the field with 3 broken ribs and a broken collarbone and a dislocated hip, and they're able to play football, and you stub your toe on Saturday night and you can barely get off the couch on Sunday to watch the football game. Certainly the $10 million a year that they're getting paid is a factor, but again, that's a factor. There are other things that drive our ability to handle pain. And it's important to keep that in mind, and don't get too hyper-focused on these structural things. And then, there are studies, and I referenced them earlier, I don't know if they went through them, but there are studies, NIH has done extensive studies on spinal problems. And imaging is not really recommended. Surgery is not recommended unless there's neurologic compromise. That means that you have a disc problem that is resulting in loss of function in your arm or your leg because it's pressing on a nerve and it's compromising that nerve. If it's just neck pain or back pain, it's really not, it's not necessarily going to help. And the downside is you can go through an invasive procedure, really end up with more problems down the road. I wouldn't be surprised with the 20 or so people that are watching it, there probably isn't a handful of you that have probably been through that. It's just that common. So these are excellent alternatives and safer alternatives in this case than opiates. And again, and I'm sure we talked the other day about it. These are better designed therapies to manage pain because they do more than just work centrally on the pain system. It works peripherally on your inflammation and settling down peripheral nerve signals. So there's more than, as well as some of the emotional factors. Anxiety is a significant component to pain, and it can be measured. I can assure you it can be measured. And in my slide deck, I can actually show you how it can be measured. And again, nobody's minimizing your pain complaint, but we just want to make sure that everybody focuses properly and on the right things to make the pain go away. And the fact that you're here listening to this already suggests that you figured that out, and that's why you're looking for it. And so the challenge isn't necessarily getting this message to you. The challenge is for you, hopefully, to share this message with other people and say, listen, this is my experience, and there's science behind what we're telling you and what we're saying. We're not making this up because we're self-serving.
Bruce, that's excellent comments. And as you know, as I think you were also pointing out, you pointed out the things like yoga. I know they use Tai Chi. They also help quite a bit. Keeping that flexibility in your body helps quite a bit that's out there. So Bruce, thank you very much for joining us. More importantly, for all the people that attended, we thank you for showing up and for attending this webinar. Hopefully it's helped you. I know my goal is I've always said, if I can help one person get their life back from every one of these webinars, that we're successful. And I think that's what we're trying to do.
And let anybody know who's on here, if they have any questions, even now, because I mentioned some stuff on CBD, and I know it maybe they don't know. You're more than welcome to give anybody my contact information, and anybody can email me with any questions, and I'll be happy. I mean, I've always made myself directly available. While I like to think I'm too busy, I'm really not as busy. I mean, I'm never busy enough to help. I mean, this is something I'm passionate about. So if anybody has a question, says, well, what do you suggest that I try to do? I'm more than happy to help. So folks, you're more than happy to share that with them. And I'd be happy to answer questions. And if they can handle it, I'll send them some political humor as well along the way.
And then also, because you signed up for this webinar, you've been dealing with an email address called event@marijuanaaware.com. You can send us questions to that. That's the easiest way to reply. You've got it in your mailbox. You left enough of your replies. We monitor that, and we'll be able to answer any questions that you might have. And we get a lot of them, so please don't feel shy. Come back and ask us. We're here to help you. We hope to help you with your medical condition. And thank you very much for joining us. Bruce, thank you for joining us.
Thanks,
and in
Mark,
the background, we've got a couple people helping me produce this, Lee Jones and Deja. Ladies, thank you very much. It's been a pleasure to put this whole thing together. And for the people that showed and attended, thank you. Please join us again.
Thanks.